it seems like the system is rigged in a way at better protecting against fat loss, right, than it is for fat gain, right? So there is sort of this like, we are going to make sure that you don't lose fat, but we are very happy to put on excess adipose tissue. And so other than some of these medications, are there ways that we can maybe other than surgery, so we don't put, we're not putting on sleeves, we're not taking GLP-1 agonists, are there ways to circumvent some of these feedback mechanisms? Because one of the things that, this is where I've changed my opinion. So I used to be a bit more rigid in my thinking and thinking, well, people who are obese that just don't have the willpower, they need to be, eat more or eat less, move more. And certainly there are, and that's, of course, when I was young and stupid and not really understanding that there are many different extrinsic and intrinsic factors, satiation, susceptibility to highly palatable foods, genetic contributors. But if someone who's listening, let's say their family or they themselves might be obese, they've done every diet in the book, they're just looking to maybe try to get to a healthy BMI. What are some ways, in your opinion, that we can maybe circumvent some of these feedback mechanisms that are designed to sort of keep us at a higher, at a higher set point?
Now, I have 7 or 8 different tools that I try to help pick with the individual to help change behavior regarding diet. And some examples of these, some people consider them tricks. I usually don't call them a trick because it's just kind of affecting physiology like a medication or a supplement. Mm-hmm. But one of them would be time restricted feeding, or like number of meals per day, the time of the meal. One of them would be the speed at which you eat. So one example of that could be you eat 3 different portions, take a 5-minute break in between all of them, or you take a turtle bite every X number of bites, which is just a very slow bite. Another one would be affecting the amount of fiber or protein in your diet. Another one would be just altering the general caloric density of your food. So sometimes that includes things that taste like they are calorically dense, but they are not as calorically dense. So there's a whole list of these, and calories is just one of them. So if you've tried different diets with just calories, it's probably time to incorporate more of these different tools.
Let's talk about timing of your meal. So there's nutrient timing and timing of the meal. When you say timing of the meal, what are you referring to? Is it time of day? Is it the order in which you consume the macros? What do you mean by timing of the meal?
Timing of the meal would be the time of the day. As far as like nutrient timing, that would be more related to which nutrients are you consuming, how close to exercise, for example. Nutrient partitioning would be another way to look at that.
Mm-hmm. And so what is your, what would be an example of meal timing? Is it, are we moving the food earlier in the day, potentially when we might be a bit more insulin sensitive versus eating late at night? Like, what are your thoughts around that?
Incorporating what the social situation is, often moving food earlier in the day and then not consuming anything after a certain hour.
I really love that, because when fasting, sort of intermittent fast, I mean, it's been around forever, but when it sort of became sort of the premier topic, we'll say, in healthcare, I myself was doing the 16-8, making sure that I was fasting for 16 hours and like not pushing my feeding window until 12 or 1 o'clock. And I was starving, like Marvin starving. Like I could eat the house. And I found that when I moved back to more of a, I tend to work out in the morning, so I don't eat before I work out, just because not for any reason other than I don't like the feeling of having food in my stomach when I'm training. But when I would come home, let's say from the gym, and start eating, that really felt great for me. And I actually have found, just personally, just the N of 1 that I am, that I actually like to eat most of my food by about 3 or 4 o'clock, like exactly like with my grandmother, the senior special, we could go and have like, dinner at 4, and I'm super happy that way. And when I eat late, I have, you mentioned Aura. Well, I think that there's some, let's say, improvements in the technology, but what it will consistently show me is When I eat later in the day, my deep sleep suffers, and my HRV, my heart rate variability, is also much worse. So I actually like to finish eating by about 3 or 4 o'clock, and I find that I am just happier that way. And that's not everybody's like that. That's just my own chronotype and what I have found to work well in my life. But I'm happy to hear that you're also maybe noticing maybe it's a certain pattern of people that where we move the food a little earlier in the day, and that 10-3-2-1 that you were saying, like making sure that the food and not a big meal, like 2 to 3 hours before mealtime. I have found that to be incredibly useful as well, both myself and with the clients that I work with too.
Agreed.
Let's talk about speed of eating, because I think that this is really interesting. I will often counsel women to chew their food 10 times on each side, or 5 to 10 times on each side. And that in and of itself seems to be just an act of rebellion because people just, they gobble, like they swallow their food. And, I've talked about a little bit about the cephalic phase of digestion before on the show. But when you're chewing your food, it's literally the only opportunity that you have for mechanical, like to break up the food mechanically. After you swallow, all of it's chemical, right? All of it is the acids and the enzymes and the assimilation in that way. But that your jaw, your teeth are the only time where you are literally ripping apart the food mechanically. I wondered if you might speak to when you're talking about speed of eating, what are some of the cues, let's say, like, just clinically when you're talking to a patient and you're trying to get them to slow down. Like my husband is like this as well. He eats his food and I've just gotten to the protein. Like I've just gotten to the main part of the meal and he's finished. What are some of the ways that you counsel someone to slow down eating their meal?
Yeah. One way, and I took this from it was a New England Journal of Medicine study on pediatric patients, actually, but they did something called a turtle bite, which they did one really slow bite at regular intervals throughout a meal. And it was kind of fun. It's kind of a game that you can play along with kiddos as well. So that's one good way. You can also divide your meal into portions, 3 or even 4, even 6. And then you can eat that portion with whatever speed that you want to, but then you have to wait 5 minutes before starting the next portion. So it kind of teaches you to even out that portion over 5 minutes, and then you can just continuously eat through the meal. So that's another way to do it. But finding a strategy that that the patient does not hate is probably the most important thing, because if they really don't like it, then they're not going to add that as a tool towards intuitive eating. So some people have just kind of thrown out intuitive eating, but the way I think of it is some people are going to be able to learn the tools to do it. So it makes sense to teach them tools like eating speed.
Yeah, I think that's great. And I feel like these are, I agree with you. I don't think that they're hacks. They're not tricks. They're just some of the principles of eating properly.